Assalamu alaikum. I am Mariam Abid, a house officer at Sindh Medical University. The topic for today's discussion highlights the biggest crisis of our time. Today, we are talking about sustainability in dental care. To understand the urgent need to implement sustainability in dentistry, first we need to discuss the major problem: human induced climate change. Climate change has been amplified and sped up by human activities due to an increase in the production of greenhouse gases since the Industrial Revolution. In 2024, global greenhouse gas emissions reached a record breaking 57.7 gigatons of carbon dioxide equivalent, 2.3% higher than the 2023 levels. The climate crisis is worsening, impacting the ecosystem, water, food production, and the health of populations all over the world. To reduce the impacts of climate change, there is a need to cut greenhouse gas emissions in half by 2030 in order to limit global temperature increase to 1.5 degrees Celsius, as agreed upon in the Paris Agreement. Human activities are contributing massively to climate change. What role does healthcare play in the climate crisis? Healthcare accounts for 5% of the global greenhouse gas emissions, according to the WHO, and dental care is a major contributor. Providing quality dental care comes at a high cost environmentally. The 5% estimate is expected to grow unless measures are taken to ensure mitigation. Globally, low income regions will suffer the greatest impacts of climate change and are least able to mitigate those consequences and least able to respond to adverse outcomes. Pakistan falls into this category. Now that we have seen the role of healthcare in the climate crisis, let's discuss how dentistry is contributing. Transportation was found to be the largest contributor to the carbon footprint for dental services in a report by the NHS. Dental facilities require large amounts of energy to operate. Dental clinics and dental schools generate massive amounts of waste in the form of single use items and dental materials. Large quantities of water are used for various cleaning, operating, and other purposes. Oral healthcare facilities use chemicals in many manners, from cleaning agents to disinfectants, dental materials, and toxic waste such as amalgam and waste generated in traditional radiographs. Having discussed the environmental problems posed by dentistry, let's talk about the solution. The solution is sustainable dentistry or green dentistry. It is an approach that reduces the environmental impact of dental practice by focusing on prevention and high quality care. Here are some ways to begin making the dental practice sustainable. Reduce the use of disposables in the dental practice and replace these disposable items with reusable ones. For example, reusable sterilization pouches instead of disposable pouches. Mitigate one of the biggest contributors to the carbon footprint of dentistry by utilizing telehealth services to minimize travel emissions. Dentists can group appointments together by family to encourage sustainable commuting options. Eliminate and reduce hazardous and chemical waste by focusing on best practices for waste handling and switch traditional radiographs to digital ones. Lastly, reduce energy and water consumption in the dental practice. Practicing sustainable dentistry aligns dental care with the Sustainable Development Goals. These are part of the UN's agenda to achieve a more sustainable future. Oral health is impacted by each SDG and vice versa. SDG 1, which is addressing poverty, can help reduce economic inequality and improve access to dental care in low income communities. Addressing hunger under SDG 2 can reduce the impact of malnutrition on oral health. Giving priority to preventive oral health care aims to lessen the burden of non communicable disease, which is SDG 3. Sustainable dentistry impacts overall health. As we know, oral health and systemic health are connected through shared risk factors, such as sugar consumption, tobacco and alcohol use, physical inactivity, high blood sugar or blood pressure, and obesity. Research has shown oral bacteria to be associated with stomach ulcers, organ infections, and pneumonia. Similarly, periodontal infections have been linked with preterm babies, GI, and pancreatic cancers. There are some direct and indirect outcomes when it comes to sustainable dentistry. Indirect outcomes, there's durable care, improved quality of care, and better outcomes. Along with these, there are the indirect outcomes, which include improved quality of life for patients, reduced costs for both patient and provider, improved job satisfaction for the providers, and very important, positive environmental impacts. Towards the tail end of this presentation, let's reiterate the importance of sustainable healthcare. The primary benefit of sustainable dentistry is reducing the negative environmental impact of our dental practice. Along with being better for the environment, sustainable dentistry helps promote public health by having a primary focus on prevention. Having an approach focused on disease prevention reduces the burden of oral disease. With the increasing implementation of the Sustainable Development Goals, sustainable healthcare is becoming a legal requirement, and we can benefit by transitioning our dental practice towards sustainability. Reduce waste disposal costs, lower utility bills, and decrease material consumption are economic benefits to the providers. With that, this presentation comes to an end. Thank you for your time. Let's work towards making the population healthy sustainably.